and welcome everyone. My name is Rachel Mead and I'm the Injury Prevention Manager at Injury Matters. Injury Matters aims to prevent and reduce the impact of injury in Western Australian community. We do this through advocating and providing education to prevent injury, as well as supporting recovery in those that are impacted by injury. Today, I'll be speaking with Dr. Julie Dare from Edith Cowan University about the impact of COVID-19, social isolation, and how people working with older adults can continue to provide support and promote healthy ageing within the context of this pandemic. To start off with, I'd like to begin by acknowledging the Whadjuk Noongar people, the traditional custodians of the land where we are based today, and pay my respect to elders past, present and emerging. So in January 2020 this year, the World Health Organization declared an outbreak of a new coronavirus, COVID-19. COVID-19, as you would all know, impacts everyone and has changed the way that we live, work and communicate. Older adults have an increased risk of complications from COVID-19 in comparison with younger people. And the Australian government has asked everyone to practice social distancing and only leave the house for essential outings. In WA, social distancing measures appear to be being effective, with the number of new cases slowing, and over the last couple of days we've had no new cases being reported. However, we've been told that West Australians should expect the social distancing measures to be in place for a few months, in particular for older people who should exercise additional precautions. So I'd like to begin by introducing Dr. Julie Dare. Julie is a senior lecturer and public health researcher in the School of Medical and Health Sciences at Edith Cowan University. She has an interest in social contexts underpinning health behaviours, including physical activity amongst older people and alcohol use amongst middle-aged and older women. Julie has also led projects investigating social engagement and social isolation amongst older adults and is currently involved with research using exercise programs to promote social engagement and wellbeing amongst frail older adults in residential aged care facilities. Welcome, Julie.
Thanks, Rachel. Yeah. So as you said, I've been working as a public health academic and researcher for, well, probably over 10 years now. And it's quite interesting, when I was preparing for this interview, I was thinking about my PhD research, which focused on middle-aged women and how they accessed networks of social support during the changes that happened to women during midlife, things like menopause and kids moving out of home and aging parents, etc. And so a lot of when I was talking to women, they were telling me about how they use different communication tools, the mobile phones, this was, going back 12, 13 years ago, landline phones, text messages. It was in sort of social media was in its infancy, but some of them were using Facebook. So all those kind of things to connect with family and friends. And there was lots of talk about how they were connecting with their teenage children using different communication tools, particularly when there were issues of perhaps difficult relationships. Some women talked about just sending text messages to siblings that they really didn't get on very well with, but it was just about maintaining that tenuous connection. And it's kind of quite relevant to what we're going through now, where we're having to rely on all those different forms of communication when we can't do face-to-face communication. So some of the women that I was interviewing couldn't communicate face-to-face with siblings or parents or children because there were difficulties with the relationship, whereas of course now we've got problems because we can't communicate face-to-face with people, particularly older people. So it's kind of quite relevant. I haven't really looked at that research for a long time, but it really kind of brought it back to me when I was thinking about this interview. And you've pretty much summed up the other research that I've been involved with, which really, since I finished my PhD, has mostly been around working with older people, looking at strategies to increase the level of social inclusion and social engagement. And over the last 3 or so years, most of that research has been around using exercise interventions in residential aged care as a means to promote social engagement, to get older people out of their room, because in aged care particularly, it's quite high levels of social isolation. People stay isolated in their rooms. So how can we use exercise to get them a little bit more connected with other people?
So, from your, I guess, contract text and background, Julie, what do these government restrictions, the social restrictions around social distancing mean, in particular for older people?
Well, particularly for older people who've got chronic conditions, they've been advised to stay at home and stay really socially isolated. And that can be a real problem for older people because according to latest stats that I could find, about 39% of older people live by themselves. And that figure is likely to be higher amongst older women because they're more likely to outlive their spouse. So we've got a significant proportion of older people who are already living alone, and so when you combine that with not being able to see other people when having to stay at home, that can increase the risk of them being socially isolated. So and we know that social isolation is bad for everybody. It's particularly bad for older people. It contributes to chronic conditions like cardiovascular diseases. It's as the research is pretty clear that being socially isolated and lonely is a significant risk factor for things like cardiovascular disease, as is low levels of physical activity or obesity or smoking. So it's a real risk factor. And I think because of that, we really need to be paying attention to how we help older people to stay connected during this period of physical distancing.
Yeah, I would agree with that. I think often people are probably thinking about social isolation in terms of the mental health outcomes, but those physical health outcomes, as you said, with chronic disease or in our context, injuries, so falls, social isolation is a risk factor for falls also. So something that we're generally trying to promote social inclusion to help prevent those things. So I guess with the context of the limitations that have been put on us in terms of how we can deliver programs and services for older people. How do you feel we can, I guess, meaningfully engage with older people during times of social isolation to, I guess, help people stay connected to friends and family and the community?
Yeah, so I think everybody as a community needs to think about how they're staying in touch with their older friends, their older relatives, their mum and dad, or it might be a neighbour if you know that there are older people in your street. It's about going that little bit extra to keep in contact with them, and that might just mean a quick phone call every couple of days, and it doesn't have to be a long phone call. It just might be a quick 5 minute check in to see how they're doing. Do they need anything? They need food or any medication or anything like that, or just a quick text message even. And certainly the research that I did for my PhD found that it doesn't have to be, you don't have to sit and talk to somebody for an hour. It can just be a really quick text message saying, thinking of you, how you're doing, do you need anything? I'm going down the shops, what do you need? Those kind of things help to people, give people a sense that they are part of the community. If older people have access to the internet, if they've got smartphones or iPads, and we tend to stereotype older people as not being able to use technology, but lots of older people actually are pretty engaged on social media, and they're right up with it. So if they are using those technologies, then a quick video chat on the phone so that they can see you, that enhances that sense of presence. If you can see somebody's face as well, that helps to strengthen that sense of connection. Doing Viber calls, Skype calls, WhatsApp, whatever it is, FaceTime, whatever it is that you're using, and that the older person uses. Again, doesn't have to be long chats, can just have be a really quick thing. And it might be that at dinner time, connecting with grandparents, putting the iPad at the end of the table so that the kids can connect with them as well.
Yeah.
For older people who aren't very good at technology, Telstra have a fantastic site that family might be able to help, or friends might be able to help an older person. That's their Tech Savvy Seniors site, and that's got all sorts of self-help videos that are really, easy to use. So I'd strongly suggest family or friends help older people, maybe direct them to that site if they can use that. If older people have been, if your dad or your aunt or your neighbour has been part of a club, maybe a craft group, bowling group, golf club or something, encourage them to reach out to those groups as well, because lots of groups are adapting what they do. So it would be worth trying to connect them, plug them back into those groups during this period.
Yeah, absolutely. As you mentioned, I think we stereotype that older people maybe aren't so good with technology, but as you said, there's heaps of people that are connected, and I think that's an opportunity that might come out of this. We're seeing a bit of a tech revolution where people are using new technologies and platforms that we've never seen before. The other day, my dad said to me, do you use Zoom? I never thought, he's a farmer, I never thought that I would hear him talking about Zoom, but he'd been on there connecting with his friends in Victoria. So that was really great to see. Also, in terms of Facebook, the over 60 demographic are the highest growing users of Facebook and the biggest sharers of content. So, Facebook Live opportunities where people can engage in live content is a really great opportunity as well. And we're seeing local governments, they do a really great job of connecting people, and they're really stepping in and making sure that those opportunities do exist for people that potentially don't utilise those platforms. Within my own local government in Coburn, I got a letter in the mail about a telephone hotline that I could reach out to if I, was vulnerable. So that there is those opportunities across many different platforms, which is really, I guess, innovating the way we connect.
Yeah, yeah. Well, I have an 83-year-old friend who does Tai Chi, and she's now doing that via Zoom.
Yeah, yeah.
So that's a group that she was formerly involved with, and they've now been able to, move it to online. So she just watches her iPad and moves along with it. So yeah, there's all sorts of opportunities. It might just, it might be that it takes family or friends to connect older people with those if they're not sort of already connected.
Yeah, absolutely. So for older people who are feeling stressed or anxious at the moment, how can they access mental health services?
There's all sorts of mental health services that are available either through telephone or online. So that the most well-known ones are things like Lifeline. So they've got a 24-hour counselling help line, a telephone number. A coronavirus mental wellbeing support service, that's through Beyond Blue, because Beyond Blue are the kind of peak organisation for mental wellbeing in Australia, and they've got a dedicated coronavirus mental wellbeing line, and that's a telephone line. So even if and then they've also, so that's telephone line, but then they've got, if you can get onto the internet, or if you've got a younger somebody who can do it for you, they've got who can assist support site, and that's got links to all the different services that can provide support to older people. There's also the Australian Department of Health have got a Head to Health site, and again that includes links. And then I think probably maybe the simplest way, if people aren't sure where to go, is to contact their GP. Because the GP will also be aware of all these support services, so they're all like a one-stop shop, if you like. If you're feeling stressed and anxious about what's happening now, then I would be directing people to their GP.
Yeah, I think that's definitely what we would recommend, people reaching out to their GPs. I guess over the phone to have a chat. They're expanding their telehealth services as well. So it might not be the case that you necessarily have to go into the clinic to see the doctor. Now, if you're concerned about that as well. So we touched on a bit earlier about the importance of physical health as well. Can you talk a little bit about how we can promote physical activity and staying physically healthy and strong during the pandemic?
Yep. So that is really important. So social distancing doesn't mean that we have to lock ourselves inside. So even if older people really have to stay at home, really do have to isolate themselves, then, assuming that they're living in their own home, they can still get outside into their garden, they can do gardening, they can, sweep the leaves. I don't know about you, but at this time of year, I've got all the leaves falling from my trees. So, that's physical activity. We need to remember that we're all probably watching a bit more TV than we might have in the past because we can't go out. So sedentary behaviour might, have increased. For friends and family with older people, if they're trying to support their older relative, it just might be about reminding them to take regular breaks. If they're watching TV, get up, move around, don't sit for long periods of time. Get out and have a brisk walk around the garden. Just doing those kind of things, and reminding them that being physically active is also really good for their mental health as well. Would be something that I would be suggesting. That's not just about being physically active for your physical health, but it's also really good for your mental health. But you can do stuff at home.
Absolutely, and I would support that. Whilst you maybe can't go to the gym that you previously went to, there's lots of exercises that you can do at home. Through our Stay on Your Feet program, we have home exercises for improving strength and balance, and YouTube videos that can show you how to do those exercises safely within your own home, as well as a suite of other resources that people can access and that health professionals can promote and share with their clients. Sedentary behaviour, I feel, is not just, I feel like it's across the board in terms of those that are still in employment. I don't know if you've noticed this since working from home, you don't get up from your desk and walk about as much as possible because you're not, I guess you don't have that daily commute, you don't have the walking to meetings or colleagues. I find myself sitting, so I have to make a really conscious effort to get up and move around and stretch for a little bit.
Yeah, and I think that goes back to kind of what I was saying before, that because we're working in the health sector, we're probably more aware of the risks of prolonged sedentary behaviour, but that's probably not that widely known in the community. So I think it would be valuable to just remind parents or older relatives or friends that it is really important to break up those periods of sitting. Just get up, go for a walk, get a drink of water, do a lap around the backyard or something, and come back in. And the other thing that you mentioned, Rachel, and I really agree with, is there's lots of stuff on the internet now. If you just do a Google search for exercises at home, or exercises COVID-19, you'll get lots of YouTube videos. But using sites like the Stay on Your Feet website, or there's another, Exercise and Sports Science Australia is the peak body for exercise science professionals, and they also have some excellent videos, instructional videos that will ensure that people can stay safe, particularly older people who might, their balance might be a little bit compromised. So they've got really good exercise programs for older people, focusing on strength and balance and mobility, that will help ensure people stay safe as well. If people have been doing, lots of older people go to exercise groups like Prime Movers or the Living Longer, Living Stronger, which I think has been rebadged now, or other exercise groups. If I'd suggest that they reach out to those groups and see if they're offering alternatives. I know lots of physiotherapists that might have been delivering the Living Longer, Living Stronger program are now delivering it, through an online means. So if they can, older people can be encouraged to plug into those as well.
Yeah. I think the other thing I was just going to add to that from a physical activity perspective, when we're looking at policy and environmental policy at the moment, I know that in terms of physical activity, there's more people out, I guess, walking and using cycle paths and that sort of thing. Particularly in high dense areas, there's a push for, I guess, emergency measures to be put in place to make sure that the roads are being used in a safe way that provides increased access for pedestrians and cyclists. I know in New Zealand and internationally at the moment there has been some rapid changes made. We haven't quite seen that happen in Australia yet. So potentially some opportunity for policymakers and local governments to make some of those I guess, more responsive changes to this as we see people start, maybe as the restrictions start to be lifted a little bit, people might still be, you know, cycling and walking more. So what are the things that we can do to support social distancing as we go back to our normal lives as we come out of this?
Yeah, that's a great point, because I've seen in my own neighbourhoods, you know, there's been a real increase in families out walking together, cycling together, which is fantastic to see, or just individuals doing it. And so, yeah, anything we can do to keep that momentum after
Yeah.
we get back to normal would be great.
Yeah, so some of the things we've seen internationally have been reducing speed limits in like those urban areas, widening footpaths and emergency cycle lanes and some road closures to support that increase of pedal and foot pace exercise. In terms of access to nutritious food, it's as important as ever to stay well nourished. What can we do to ensure that older people still have access to nutritious food and their essential medications?
Okay, so again, this is where that network of friends or family, or in the absence of those, neighbours, really need to step up and check if older people have got the, you know, necessary, you know, essential foods that they need. You know, maybe just sending them a text and saying, you know, how you going? You got enough milk? You got enough bread? That kind of thing. People can be doing, you know, cooking meals, freezing meals for them, and also, you know, don't forget that frozen foods and tin foods are really good nutrition as well. So if older, you know, if you're not able to get fresh food all the time, frozen and tin foods provide really nutritious, you know, source as well. Most stores now are offering online shopping, grocery stores, and for older people, the Australian government have introduced a priority service. So if older people are registered with the My Aged Care website, which a lot of older people would be, then they're going to have priority access to online shopping. There's a telephone service or an online service, so I'd suggest that they look at those. And that's through all the major supermarkets as well, so they can get their, you know, food delivered as a priority.
Yeah.
Local, you know, local WhatsApps group. You know, we've got lots of neighbourhoods have Facebook groups. You know, those buy, swap, and sell. But you could use those, repurpose those to check that people in their neighbourhood, older people, aren't falling through the cracks. For medications, older adults that have pharmaceutical benefit scheme meds, so most of their prescriptions will be covered under the pharmaceutical benefit scheme, or the repatriation pharmaceutical benefit scheme for veterans. They can have all those medications delivered to them at home. Pharmacists can dispense up to a month's supply of medication without a script. So again, it's just older people, in regards to medication, talk to their GP or their community pharmacist about that, and they'll be able to connect them, you know, sort them out with that.
Yeah, great. In terms of the news cycle, it is constant at the moment, and can be overwhelming and stressful for people. There can be a lot of misinformation on social media as well. How can we support older adults, I guess, to filter out this information and make sure that they're getting the clear, relevant and accurate information and advice for them?
Yes, so it is a bit overwhelming at the moment, isn't it? It is so much information coming. The Australian Psychological Society have got some really useful information on their website, and they suggest sort of a three-pronged approach to helping older people manage anxiety at this time. So firstly, they say, and this is good advice for everybody, really. It's not just for older people, but firstly, make sure that you're getting your information about COVID-19 from credible and reliable sites. So that would be the Australian Department of Health, the West Australian Department of Health, or the WHO. If an older person doesn't have internet access, then there's a national coronavirus helpline as well. So people can just ring up and then they know that they're getting credible information about the virus. The second thing that the Australian Psychological Society suggests is that you limit your exposure to news about or media or even conversations relating to COVID-19, because the more that you listen to it, the more that it kind of becomes overwhelming. So just try and limit your daily diet of information. So maybe just just check on the news at night time about where we're up to, rather than listening to everything that's coming through, or checking Twitter, or and again, not stereotyping older people. They're just like to be on Twitter and that kind of thing, or Facebook. So kind of monitoring how much you're exposed to all that news. And then the third prong is to encourage older people, and again, this is useful for everybody, put your concerns about the virus into perspective. So think about, okay, what are the actual risks of this virus to me and my family, as opposed to the kind of what you might build up in your head. So we know that older people, the evidence is showing that older people aren't more likely to contract the virus than younger people. They may be more at risk if they've got chronic disease to having it more severely, but they're not more at risk of contracting it in the first place. So put it into some perspective. And then secondly, think about, try not to catastrophize how bad it might be, and think about, okay, in the past when I've experienced crises, or my family have experienced crises, how did I get through those? I managed to get through those, so I'll be able to do it again. So it's kind of putting things into perspective so that you don't get it out of proportion.
Yeah. And I think, as you said, that is relevant for everyone at the moment, because it can be very easily, everything can become all consuming. Even on my own iPhone, I don't know if you're the same, I have a thing that says how much screen time I had in the last week. And when this all started, I noticed my screen time went through the roof. So it's that really conscious decision to just stop, focus on what you need to, and watch the news once a day to get an update on how we're tracking. And it's looking positive now, which is really good in Western Australia anyhow. But to block out some of that other stuff. And as you said, those other conversations when you are talking to other people, talk about different everyday things, not just about the current pandemic.
And also just remind yourself that this is time limited. This will pass.
Absolutely, yeah. In terms of services adapting to, I guess, cater for the needs of older people, is there any kind of standout examples that you've seen that have adapted really well? At the moment.
Look, I think there's lots of organisations that are being really nimble in adapting. I was looking at the Injury Matters website yesterday, and you're obviously doing lots of work in this area. the videos that I mentioned before from ESSA, Exercise and Sports Science Australia, they've developed these ones specific for this period and specific for different groups. COTA, Council on the Aging, their website is really good. They've got lots of resources that they put up there, obviously specific to older people. They've got there's the link there called "I want trustworthy information on the virus. Where should I go?" And that, of course, directs to the Australian Health Department, that kind of thing. Even the organisations where you would think that really you do need to be in contact. So I was listening to somebody on the radio yesterday, and they were talking about how men typically, maybe aren't drawn to telephone conversations or online conversations, but they're more about that shoulder to shoulder, so they communicate when they're doing things next to each other. So organisations like the Men's Sheds, Australian Men's Sheds, they've got an online service now. And so that, even they're recognise, okay, so men can't be together now, but there might be a way around that. So all sorts of organisations. You mentioned before the City of Cockburn, like you said, lots of local governments. I looked at the City of Wanneroo because that's a local government that I've done research with in the past. They've got they're developing services now for older people in the community to connect them. So they've got a designated phone number for older people if they need assistance, if they just need somebody to talk to as well. Yeah. So lots of organisations I just think they're amazing. They're doing amazing things in this space.
Yeah, absolutely. And my colleague told me earlier, if you go on to the WALGA website, you can look at what specific local governments are doing across the state in response. And there's information in there specifically on older people as well, which is really great. Kind of brings us to the end of our conversations. Do you have any, I guess, final thoughts or comments on what individuals or organisations can do to promote healthy ageing during the crisis, or anything that you want to add?
Look, I just to reiterate, I think that organisations that work with older people are working really hard to support older people and their families during this period. So I think that's really commendable. An area that I think could be enhanced a bit is more of an outreach for older people, particularly those who have been previously volunteering, because we know lots of older people volunteers. They form the bulk of the volunteer workforce. And those groups like Prime Movers or the Strength for Life, which is the old Living Longer, Living Stronger program. It might be because I go to a Living Longer, Living Stronger program because I'm over 60. And I love it, and I'm not able to go because that's closed down for the time being. But what I would really like to see is those sort of organisations or groups putting their members into contact with alternative services. So it might be that people, so COTA is running the Strength for Life program. It's connecting people who would normally be going to those programs, connecting them in with things like the Injury Matters, the Stay on Your Feet videos, or the ESSA Stay on Your Feet videos, because the members wouldn't necessarily know without being, they wouldn't know without being told that these other alternative sites can support you to keep you being physically active, for example. It might organically happen for some older people, they might know, but lots of older people won't necessarily. And I do really wonder about the people that I do my Living Longer, Living Stronger program with. I wonder just how they're, whether they're still managing to stay as physically active as they were before. So that outreach service kind of plugging people into, so it's not about necessarily those services that say Strength for Life, developing their own online resources, but just connecting people to alternative existing services.
And I think that's probably an interesting learning, like over the last few weeks for us, because we have been trying to mobilise and work out what we can do. we don't have to create everything ourselves, and that's what I guess I would say for other health professionals or people working in local government, fitness instructors that used to deliver a class. Don't, I guess, if you can create stuff and share because you have those personal connections with your clients already, then that's great to do that. But if you can't, as you said, S has got content, tap into those existing resources and share that.
Yeah.
I guess we don't need to reinvent the wheel. There's lots of stuff out there already that you
Yes.
can share. And I guess that's what we've been looking at doing, is repurposing what we've got. We do strength and balance information. It's repurposing that information into the online context a bit more. One
Yeah.
new activity that we've just kind of been getting off the ground, we had a platform for connecting health professionals that work in injury prevention. And what we also have a database of a lot of older West Australians. So what we've decided to do is repurpose that online platform, and we've started a program called Community Connect, where older adults can be randomly matched with another person, and it's just to have a chat, just that connection. It doesn't have to be about anything. It's just a random match for people that want to participate. So we definitely recommend that people promote that if they're looking at trying to create connections amongst older people.
Yeah, that sounds like a brilliant idea.
Yeah, well, time will tell. It would be interesting to see, if we get people participating, different people. I guess we're hoping to reach out to people that maybe don't have those social networks in place already. Maybe people that didn't go out and join groups previously. Maybe this might be a different alternative that they might be interested in participating in.
Yeah.
So,
Yep.
yeah, thank you so much for chatting today, Julie. I found it really interesting and insightful, and I hope everyone else did.